My name is Kevin Harris. I'm the systems analyst with the Health Management Information Unit, Ministry of Health, St. Lucia. St. Lucia is a very small island, about 238 square miles. Our population at the last census was about 170,000 persons. We have 34 health facilities spread out across the island. So the environmental health programs, they use the DHIS2. So in the initial consultancy, the consultants actually created a module for food safety, water safety, and occupational health and complaints. So they designed the forms in DHIS2, and that was our first introduction to DHIS2. So they are using those forms to do the inspections of the food establishments in order to be able to grant them a license. And they also use it to do their monthly reporting and yearly reporting to the ministry. The food safety inspectors are the ones who enter the data. They can either do it in real time through the use of tablets and using the offline app, or they enter it when they get back to office directly into the system. So they do the inspections and then they produce the reports monthly for the ministry. Every single food establishment in St. Lucia has to be licensed. So every establishment is supposed to get inspected twice a year. Plus, they also have to do events. So like when we have our jazz festival, when we have carnival, all those persons, those vendors selling food on the sides, all of these persons need to be inspected and licensed. And so there's a lot of inspection that needs to take place. Based on the limitations that our food safety department has, they do a very, very good job in containing and ensuring food safety in St. Lucia. To my memory, we have not had any outbreaks or major outbreaks of any major foodborne illnesses in St. Lucia, which is testament to the good job that they actually do based on their limited resources. One of the things we want to do in the DHIS2 is actually be able to print the license from there. So they enter the data for the license. We actually record all of the license data. They print it out separately, but we want to be able to do the complete process in DHIS2. So once everything is entered, they can just click print and then have that license printed. Another thing we want to do is, in terms of the persons who work in food, they actually supposed to get a doctor's medical certificate. So we are looking at integrating DHIS2 with our health information system, so that once you go to a health facility and the doctor issues you that certificate, that information is pushed straight into DHIS2. So by the time you go to environmental health, for you to get your license to operate as a food vendor or food worker, that information would already be in the system and they can verify it. DHIS2, like I said, we use it primarily for environmental health, but we have realized the massive potential of it in terms of reporting and analytics. So we actually want to use it for that. We are currently looking to rebuild St. Lucia Health Information System from the ground up, because as part of the licensing agreement that we had with the company, we cannot touch what they call the core of the system. That limits us in terms of what we can do, and the core is pretty old, which they don't even support again. So we have made that bold decision to rebuild it from the ground up. We have actually started, we did a pilot where we had our immunization data. We ported it over to DHIS2 and we were using it to create dashboards for the Epi manager to actually use, and that went pretty well. So we intend to actually use it and maximize it in terms of reporting for our supervisors, managers, and ministry personnel. They will be able to retrieve the data in real time. They will be able to see trends. They will be able to get alerts of events that they're looking out for, etc. So we see a lot of benefits in terms of that. Right now, if they want to access data, they have to contact our unit, and we try to produce the reports for them. Sometimes we do data extracts, and then we send it over to them as a CSV file or Excel file. So that way we can get the data seamlessly across from us to them, which would improve efficiency and accuracy. We are very, very thankful to agencies like CARFA and PAO to provide support for us in building capacity within our unit to manage and to effectively use the DHIS2 system. We have been able to see that it can work based on some of the use cases that we have heard from other countries who have been using it for a while. It lets us know that we're on the right path and that we're heading in a good direction. So we're expecting a lot from DHIS2.